I'm Representative Al Baldessaro, and I'm with my wonderful co-host, Representative Jeanine from Merrimack, and this is Who's Looking Out for You. Jeanine, we're back again.
Back again?
Yeah, we're back.
5 minutes.
The last show we taped, we had a great person from
603
Liberty
Alliance.
Liberty 603.
And now we're going to be discussing a topic that's near and dear to both our hearts.
And I won't even get into your running it in this one here.
Right, well, they already know. I'm still at 1,053 miles since January 1st.
Are you going to go running after the show?
I ran this morning.
Good.
Yeah, well, I swam. It's very humid. But
we have a special guest today, and I think it's very important throughout the state, especially I have a lot of veterans in Londonderry, you do in Merrimack, and we throughout the state. Well, probably almost 130,000, somewhere around there, of veterans. And Al Montoya, I met him before, he was in White River Junction. When they had a big changeover in Manchester, Al was the god that came in, I'm using that word, because he straightened out and fixed on taking care of veterans in the VA. And he's a veteran himself. So I want to introduce you to the director of the VA in Manchester, Al Montoya.
Yeah, good
Welcome
afternoon.
to Londonderry, Al.
Thank you.
nice to meet
It's
you.
nice to be here.
It's
Thank you.
you want to?
I do. I have a very important question because, well, Al and I both served on Veterans Affairs. Now, he says veteran always, and I sometimes say veteran.
Yeah.
So would you just tell us, what is it, veteran, or does it matter?
So I don't think it matters, right? I think the underlying thing is that, veterans are those that really gave that ultimate sacrifice in some cases, but really fought for our freedom. And so for me, I say veterans, but I've also heard it say veterans,
Right,
veterans.
because there's
Veterans,
an essence
yeah.
the other way
fears.
around, absolutely.
You know, because I look at each individual as a different case.
Yep.
And I'm sure you do that at the VA. But tell us, now that you're in the VA, you're no longer at White River Junction.
Sure.
The listeners that watch this here,
And the VA stands for Veterans Administration.
It actually stands for the Department of Veterans Affairs. So what's interesting is it actually went from a non-cabinet level agency over to having its own secretary, some years ago, and so that changed it from the Veterans Affairs to the the Veterans Administration over to the Department of Veterans Affairs.
I did not know that because I was on the Veterans Affairs Committee, and then they moved me into science. So.
Yeah.
So all these changes happened afterwards.
So tell us, what is your job? What do you do?
Yeah, so my job is Chief Executive Officer and Medical Center Director for the Manchester VA Medical Center. I will tell you that's all encompassing. I will tell you that my job ultimately is to make sure that the veterans in the Granite State get access to high quality health care throughout the state. So whether that be at our 4 community-based outpatient clinics, or whether that be at our main facility in Manchester, that's my job, is to make sure that they get access to care.
Where is it? I've been there before for a meeting, but I don't remember.
So the VA Medical
located.
Center is located up on Smith Road in Manchester.
Oh, Smith Road.
Now, how many clinics do we have, C-boxes?
Yeah, so we actually have 4 clinics.
Didn't we
Conway.
used to have more
What
than that?
did you say? C boxes?
Yeah, so CBOC, it's CBOC. It stands for Community-Based Outpatient Clinic. Essentially, they're like your doctor's office in the community. So we staff those with physicians, nurses, staff to make sure that veterans in their communities can get access to that care.
No, we had always had bills that we worked on to give every veteran a card so they can go anywhere.
Right, a
now,
medical card.
And do they have
And
that now?
Yeah, that's a choice program. You can.
So they do, yeah. It's the choice program. Right now that's run through our Office of Community Care. And so our veterans in New Hampshire is a little unique in that veterans have the ability, if they're outside 20 miles from Lebanon, New Hampshire, they're able to go out into the community and see a provider in the local community.
No. Do people live at the veterans building?
Sure. So I will tell you, at the Manchester VA, we actually have a community living center or a nursing home, 41 beds, and so we have brave men and women of all different ages that actually live there. They call that their home. We primarily offer outpatient medical services at the Manchester VA in addition to the community living center.
Now, what's the youngest veteran you have there in the nursing home, and the oldest?
Boy, that's a good one. Yeah, I would have to get back to you on that one. I know that we have several that are approaching 90, the upper 90s, but the youngest one, I would have to look and see what that is.
If a veteran was looking for had issues and things like that, What type of clinics do you have at the
Sure.
Manchester VA?
So I think, we primarily have, primary care, mental health, I would say other specialty clinics as well. So if you look at the same things that you have in the community, dermatology, optometry, dental, you name it, the whole variety of clinics that you would normally, that a non-veteran would see out in the community.
Awesome.
Now, I presume you're affiliated with they don't call it the Old Soldiers Home anymore, but the facility that's in Tilton?
Veterans Home.
So we are in a way that we provide services to them, and their veterans come down for appointments. That's a state-run program. So traditionally what happens in the department is that nationally the VA provides support to state veterans homes, fiscal support. So part of my budget actually goes up there to the commandant to be able to take care of our veterans
Right.
up there.
Yeah.
And the nice thing about the Veterans Home is, unlike a regular nursing home, they get about $365, at least that's what it was last year, per diem, per veteran from the federal government to run that home, along with state funding. Okay, in the nursing home under Medicaid, they get like maybe $145 to $165 per day, for patients. So it's a big difference to make sure that the veterans get the best care in the world over there. And you were talking about yesterday, you were talking about eye doctors here, about cataracts or something going on?
Yeah, so one of my jobs when I got to the Manchester VA back on July 17th of last year was essentially to go and look at every single service at the facility to make sure that we were staffed appropriately. So one of the new services that we've brought on board is ophthalmology. So when you think, many of our, not even veterans, but some residents in the Granite State are aging, and so that's one of the first things that they, really need assistance with. And so we were able to bring on board a brand new ophthalmologist. His clinic started this week, and probably within the next month we'll be able to do cataract surgeries at the Manchester VA.
Nice. Well, I just went to the eye doctor a week or so ago, and he told me we all get cataracts, so I'm over 50, and he sees me out running. He told me to wear sunglasses
So
outside.
me at 39,
So,
I
and
gotta wait till I'm 50.
I meant to show you these. These are my new glasses, and they're made out of gunmetal.
Awesome.
Isn't that cool?
Yeah. So me at 39, I gotta wait till I'm 50.
When
to
you're
get
30,
cataracts?
yeah.
Okay,
So,
just
well, he said
checking
we
there.
all get them.
Yeah.
Yeah.
Now there was an ENT. You're hiring an ENT or
Correct.
something. You told me
Ear, nose,
past
and
there,
throat.
right?
Yeah, so we are hiring at the Manchester VA. I would say not just in ear, nose, and throat.
Right.
Another one of the services that we looked at when I first got there was primary care. So on average, outside of the VA in the local area, it takes around 75 days for anyone to go and get their new primary care appointment. So roughly 2.5 months. We were no exception. However, as a veteran myself, that's one of the
Thank
I
you
have
for your
to
service.
thank
And
you.
he uses the VA
I
himself.
do, yeah. And so, we have to become the provider of choice. Well, how do we do that in a state where veterans can choose to go out in the community? And we have to really do that by focusing on access to care and the veteran experience, while also additionally focusing on the employee experience, because we know if the employees are satisfied, then the experience that the veterans get is even better.
How many employees do you have?
Yeah, so we have roughly right now about 850 employees that take care of the 26,000 veterans in
Wow.
the state. So back to my example about primary care, so the local wait time was about 75 days back a year ago. For our veterans, we were seeing them anywhere between 70 and 80 days in Manchester. When you look at that problem, we dove really deep into it to say, okay, is it staffing? Is it clinic size? What does that look like? And so we were able to bring on a whole host of primary care providers, brand new providers, and we've gotten that down to 19.7 days as of about a week ago. So if you think a reduction of, what is
That's
that,
huge.
40,
That's
50,
a-
50 days in some cases, but that's how you become the provider of choice. So we really, that's one example of primary care. We also did the same thing in mental health. We did the same thing in the different specialty clinics, like ophthalmology, like I had mentioned. So really taking a really focused approach to get out there and improve the care for veterans in the Granite State.
We went on a field trip when I was on the Veterans Committee to the home in Tilton, and the nurses were telling us, these are old soldiers. You don't go up and tap them on the back because they're
Right.
going to turn around and
Absolutely.
snap your finger.
Right. Yeah.
And I think that certainly is the same case at the Manchester VA. The great thing about me is that I'm a veteran, right? And so I mentioned that a
understand.
second
You
ago.
can
Yeah.
relate.
You know, I joined the Air Force right out of high school, essentially.
My boys are in the Air Force.
And joined, you know, to be a Russian cryptologic linguist.
Oh, cool.
So when you look at a Russian linguist to a hospital director, it's not really a straight line whatsoever.
Right.
Where were you
but-
stationed, can I ask?
Yeah,
Did
so-
you go to Goodfellow to train?
I did go to Goodfellow. That
know,
was
we
my
used to live
second
there.
duty assignment.
Yeah.
I started in Monterey, learning the language,
I'm
then
from
went to
California.
Goodfellow, and then went up to Fort Meade, Maryland,
So-
so where the National Security Agency was.
So when were you at Goodfellow? I'm just curious because
Yeah.
that's where we lived.
Yep, so I was in Goodfellow late 99, beginning of 2000.
Oh, we were there 89 to 91.
Okay.
Yeah.
Yeah, and so my first duty assignment was, like I mentioned, Fort Meade, Maryland, where the National Security Agency is, and I absolutely hated that assignment. You know, I had joined the Air Force to be alongside airmen, to see the planes and to see, you know, the flight lines
Right,
and to
yeah.
be a part of that action. And I was in a building with no windows,
Right.
with you know,
Right.
security
Yeah.
all around, working rotating shifts, and I was stationed
vault in the vault,
alongside
yeah.
Navy personnel. And so for me, I said, I didn't join the Air Force to be in the Navy. And so I took my first remote assignment up to Anchorage, Alaska.
Oh, nice.
And so after
Pretty up
being
there.
in Maryland for a year, moved my whole family up there, and absolutely one of the best assignments of my life.
Wow.
From
Nice.
there, I went down to Tucson, Arizona, where I signed up for
Wow.
another.
One extreme to the other.
Did
you
you
know,
retire
it's-
from the Air Force?
You know, I did not. No, I did
Okay.
10 and a half years.
Yeah.
And so right about the 9.5 year mark, I got really sick. Had to go to the doctors multiple times, ended up in the hospital, you know, for several stints, a couple weeks at a time. And so then I was found to be eligible to be medically separated. I could not stay in, you know, and at that time I was flying on the back of an EC-130H. So, you know, think of it, the cargo plane
know
with
what
the
it
four
is.
propellers, but you
Right.
jam in all the electronics countermeasures. And so in that case, you know, I wasn't eligible to fly anymore. And you know, followed my wife to Connecticut, where she, you know, is a professor at the University of Connecticut, and she essentially took over in taking care of our family from there. But, you know, that was really my first view into being outside of that veteran family.
Right.
Right. And so I started at the University of Connecticut as a student, and I didn't feel like I belonged. At that point, I got a job at the Department of Veterans Affairs and haven't looked back ever since.
Oh, that's
Nice.
awesome.
Wow.
I mean, they miss them at White River Junction. I tell them,
bet.
your loss is our gain. That's tough.
Yeah, sounds
you
like
know.
it.
But I mean, the things he's done. I mean, you were there, what, 3 months, whatever, when the pipe,
So I was there
broke
3
in the
days.
operating
So
room?
I got there on the 17th of
Oh, 3
July.
days?
Yeah, I got there on the 17th of July,
Mm-hmm.
and by the 19th of July, at about 4:30 in the morning, I got a call that thousands of gallons of water were going through the building.
Oh.
And so it literally damaged from the 7th floor down to the 2nd
Were the
floor.
patients affected?
It wasn't so. Luckily, in this case, the Manchester VA, that portion was outpatient only. So it's separate from our community living center or our nursing home. And so we were able to get in and mitigate very quickly. But the damage, you know, really, when you have that
Right.
much water, then
The
you have
operating rooms
you know,
and-
mold and all of that, the
Yes.
potential for all of
They
those
can have
things.
to tear- they don't-
So it really damaged about 61,000 square feet of
But they
of
were
our
able to save
campus.
it?
It took us about 11 months to do all of the repairs, you know, from essentially the 2nd floor all the way up to the 6th floor.
Now, I just let him into this question, you know that.
Yeah.
Because I have to ask, whose idea was it to put that plan in place to utilize like the Elliott, CMC, the operating rooms?
Yeah, so that was a very interesting thing that happened. So the day of the flood on the 19th, I was running around, literally in some cases in water, you know, that deep, and being new, you know, 3rd day in
Oh,
New
your
Hampshire.
3rd day.
You know,
Welcome.
really wondering how fast can I get back to White River? What does this look like? When's
Right.
this assignment going to end? You know, this is crazy. And our community providers, so namely the Catholic Medical Center, their COO, Alex Walker, called on my government cell phone. He had gotten my number from someone, and he gave me a call, and he said, "Hey, we're at CMC, and we're ready to help. If you need anything, let
Nice.
us know." And sure enough, within about an hour, I called him back. That same week, I met with him on 2 occasions for a couple of hours each. And that was really the starting of a fantastic partnership, and really a model now that, you know, we used that example there, coupled with Governor Sununu's executive order to allow VA providers to practice out in the community, that really sets the stage for a brand new model for the entire department.
Right. And then, you know, because really a lot of people don't realize that executive order had a time limit. So that expired, and the governor really didn't have the authority because per the New Hampshire Constitution, the legislature, the House and the Senate are the superiority of, you know, and the governor complies with our laws along with the executive council. So that's why I went into the governor and said, Governor, we need to fix this soon before.
Yeah.
And we came up with the legislation. I filed the bill, and then I co-sponsored Jeb bill. You know,
Jeb Bradley?
Senator Jeb Bradley's bill, so that way there, one way or another, we had it coming both ways. My bill passed the House first, went over to the Senate because I was fast-tracking my bill. And then the Senate, one of the senators on the other side put in a amendment there with a time limit. Jeb Bradley's came over to us. There was no time limit, so we had a committee of conference, and we used Senator Jeb Bradley's bill. And I said, no, just kill my bill. We need one. We got to get it passed quick.
Yeah.
And, you know, now it's permanent now, so you
Yeah.
can, and aren't we the first in the country that, with that?
So
what
we
you
are
did?
the first in the country, yeah, and the Granite State is full of a lot of firsts, and that is certainly one. You know, we went back down to DC with this model and really did a lot of research to say, you know, are there other states that have VA providers practicing out in the community? And so this was a huge win for all of
Right.
us, and I think, you know, people don't understand that without that partnership, we would not have been able to do things like our colonoscopies, endoscopies. You know, we essentially would have had to stop what we were doing
Right.
at the Manchester VA and essentially feed that out into the community. And, you know, so for me being a veteran, you know, getting all of my care at the VA, you know, this is personal to me. And
Right.
so when you take a look at that kind of example, you have to really say, well, how do we get to yes? What does that look like? You know, oftentimes, you know, you see, you know, in fact, at our medical center, we have buttons that say, because we've always done it that way, and it's crossed out.
Yep.
Because I
love
think,
that, yeah.
you know, you have to get into that routine of trying something different. Otherwise, if we wouldn't have, you know, we would have not had things opened up at the Manchester VA, not had such great partnerships, you know, across the state.
What used to come up every year on the Veterans Affairs on the committee, the State House, is Alaska and New Hampshire are the only two states that don't have a VA hospital. But if they're allowed to go to these other places, are we good now? I know Alaska
yeah.
doesn't need one because they have so many bases there.
Well, you're saving a lot of, sending a lot of older veterans to Massachusetts.
So we don't have to do that anymore, right?
Well,
you
so
can
what
do it.
we've seen is we're on track this year since the beginning of our fiscal year to really have only sent out roughly 800 veterans down to the Boston healthcare system for their care. So things that we would not have been able to do otherwise at the Manchester VA. What that is, though, is a 45% reduction over the last 3
Right.
years. So we're essentially now making sure we have the staff at the Manchester VA, making sure we have community partnerships, making sure that we're taking care of our veterans in a very different way than past
Oh, that's
times.
awesome. You know, I myself, I have full coverage insurance from being retired, but I use the VA because I see too many talking heads that say, oh, the VA's bad, it's this, it's
Yeah.
that. I don't see that. I see sometimes prolonged time, a long time to get in. I've seen that before, but I also see it better. The Manchester sent me down. I got a new doctor. He sent me to Jamaica Plains for the CDNT, because for many years they put me on a special, you know, these pills to dry up my sinuses. Come to find out it was a cyst. I went to Jamaica Plains. What a beautiful place. The people were there were unbelievable. I had the operation. I was in and out. You know what I mean? So, and I only did this here so I can see how our veterans are being treated. I went to Roxbury, you know, and seeing how they were being treated. I was very impressed over there. So anyone that talks bad about the VA system, they really don't know what they're talking about. Yeah, are they perfect? No, they're not. Are there growing pains? Yeah, there are when you're dealing with that many people. And my question here, you said 28,000 veterans in Manchester.
26,000. Yep.
How many up north in New Hampshire is now, because they deal with White River Junction, how many veterans they taking care of up there?
You know, so I would have to also go back and look at the numbers because
I
there's
mean,
that brand
roundabout
new
it.
clinic.
Just take a
you know,
guess. What would you say?
Well, so if you think up in Littleton, New Hampshire, there's a brand new community-based outpatient clinic that falls under White River Junction. It's roughly about 10,000 square feet. So there's at least a couple, 3,000 veterans that get their care up out of that
Okay,
clinic
yeah.
there. So I think, you know, what we've also done, and not just partnering with the community, but we're also partnering more with White River Junction. So it happens that, I know a lot of folks still back there that we pick up the phone, we say, how can we collaborate? What does that look like? Can we bring on, a half-time provider that we can share, that you can bring on? Is there someone who, in one case, we have a pulmonologist who is coming down and seeing veterans in Manchester and then giving the veteran the opportunity, if they want, to get their care at White River for the surgery or any kind of procedure that may happen. So, we have to think of it differently in the VA now to say, how do we become a provider of choice, especially in the Granite State, being one of the states that, veterans can go out in the community and they can get their own care and line that up in many cases. We have to make them choose us. And so that's why, I'm out in the community so much. We're, reinvesting in our providers. We're bringing on new services. We're really trying to say, look, this is your VA. What can we do to make sure that we keep this thing going?
And what can the state legislature do to further improve things for the VA system?
Yeah, so I think if we look at the numbers, right, we take care of 26,000 veterans every single year. The more veterans that come in and utilize the Manchester VA, the bigger my budget is, and the more services I can bring on to the
tell everyone,
center.
whether you use it or not, go sign up.
Yep.
It helps the numbers, because I have to keep telling people, we don't have the numbers to justify a full service hospital. Because you have a contract, you used to have CMC contract for all heart and everything else, but you also have a contract with Concord.
That is correct.
And that works out great, because when I had my heart attack,
He drove himself to the
I
hospital.
drove myself from the governor's office over to Concord. But this is something I need you to explain, very important here to the people watching this, because I hear all the time, somebody that in an ambulance wants to be taken to the emergency room because they're worried about the cost. They figured once they go to the VA, you send them to CMC or Concord. What do you recommend for these veterans that are watching this here, families, that they should be doing?
So first of all, I would recommend for any veteran to come in and see a benefits individual at the medical center prior to an emergency happening. What I found is that every veteran has a very unique scenario. And so it really kind of depends on what their eligibility is. In some cases, if a veteran is 100% service connected, then we will take care of the medical costs and things that they may incur. In other cases, if they're not service connected, we may not. And so rather than getting all the way to the emergency room and then waiting, I'll tell you, actually it was about a month ago or so, I had a veteran call into my office. So I have an open door policy. Al knows this.
It used to be locked to get in there. You couldn't get in to see the director. Now it's open.
I give out my cell phone number at town halls. I encourage veterans to call me. And so one day I did have a veteran call me. And he was kind of fading in and out, and I called him by his name, and I said, where are you? And he said, I've just gotten into a really bad motor vehicle accident, and I'm actually at the hospital, and I'm telling you so that it's covered when all the bills come in, so that I can make sure that I don't have to be responsible for these bills. Now, luckily, we were able to look at that individual's case and say, you're absolutely right, you are covered. But it's really dependent on every single veteran to really know what their benefits are and to go in and have that conversation.
So if somebody's 10, 20, 30%, there's only certain things you cover for that actual disability, right?
In some cases, yes. And so, it's really the message that should go out to veterans is that they should know what their benefits are. They should come in, they should send me an email, call me, come meet with our 2 new patient advocates, and really know what they're covered for and what they're not covered for.
I'm glad you brought that up. You had one patient advocate for a long time that was overworked, in my opinion. Now you got 2.
Yeah.
I was impressed with that. I said, wow, somebody's seeing the light here, thinking out of the box now, because Marty, as far as I'm concerned, she always returned my call. Sometimes it might have been a week later because she was so busy or whatever, but she always returned it. Now you got 2 and you're open longer hours.
Yep. So that's, looking at business in a completely different way, right? And so we were able, with our last patient advocate retiring, to say, how do we improve the veteran experience? What does that look like? And so we did bring on 2 brand new patient advocates. One is a veteran. I believe he's Army. So you can't hold that against him.
I was just waiting for him to say that.
I actually was in their office yesterday, and I met the lady that works in there. She's a former nurse.
Yep, she's an LPN, and so they now take turns in that office, that they're in there from essentially 6:30 up until 5 o'clock at night. And so when one of them is not in that office, they're up in a different office, returning phone calls, reaching out to veterans,
Right.
mitigating their concerns, and really kind of getting to the root of the problem.
I was very impressed with that yesterday when I seen that, because I always stopped in to see Marty Jones and say, Marty, how you doing? Did you take care of this veteran that I sent you there? And she always took care, but sometimes, like I said, she was just overworked. She just couldn't keep up with them.
Yeah, and I think that was how all of our staff were feeling.
Right.
Right. So when you look at my example of primary care wait times, really getting them down to 19 days for a new veteran in Manchester to get seen. When you dive deeper into that problem, we didn't have enough primary care providers. Well, you look even further into that, we weren't paying them enough. So we were expecting them to come on, and you're not going to get rich being in the federal government, but we at least expect you to be making enough to make ends meet. And in some cases, we had primary care providers who were not getting paid enough, and so there was constant turnover. There was providers leaving all the time, and some teams had double the amount of veterans assigned. And so we really had to look at that. And back a year ago or so, we couldn't even get primary care providers to want to come to the Manchester VA.
See how well Air Force guys get things done?
Oh, you ain't kidding. There's something I need to bring up also, and I want the listeners to really pay attention to this. Moms, dads, sisters, brothers, anyone dealing with a veteran that's suicidal, what would you tell them on this show that they should do? Because I got about 1 minute and 47 seconds left.
Sure. So I would say they can always bring them into the urgent care that we have that's staffed 24/7. There's also a veterans crisis line, which certainly we can provide after the show to get out there to folks. They can always call me as well. They can call the facility. The number one thing is to get someone involved.
Right. We should actually do a whole show on that because that is such an
it's
important
such an issue.
Yeah.
And
in
it's
fact,
devastating.
it is, and that's why it's the number one clinical priority for our secretary. Really getting out there and reducing suicide amongst veterans. We take it so serious. We have 2 suicide prevention coordinators at the Manchester VA.
Right.
That's all they do. They're focused on reducing suicide.
So 24 hours open at the urgent care center, get them over there, right?
Yep. I would say get them to the closest medical
Right.
center.
Oh, yes.
And if it happens to be the urgent care.
Well,
at the
sometimes
Manchester
veterans
VA,
want to deal with veterans.
Absolutely.
You know what I mean? And it's a big, and that's my finding of being a 22-year Marine, what I see.
Yeah.
But anyways, we're going to put your website out there. I mean, how do people get in touch with you and the VA?
Yep.
The main number and stuff of veterans that didn't want to sign up. Maybe they want to sign up now.
Sure, and I would say, our website is www.manchester.va.gov.
Okay,
I will
make
tell
sure
you,
we'll put that on the screen too.
Yeah, and I will tell you that we're also out doing other outreach events. So this past weekend we were at the NASCAR event. We were able to register just over 50 veterans, new veterans into the system.
That's
so
awesome.
We're doing tons of outreach.
Well, I'll tell you, Al, it's a pleasure. I wish we had an hour show with you
Likewise.
because there's some great information.
Likewise.
We'll be back with another show. This is Who's Looking Out for You. Thank you, Al, for coming in.
Of course.